Our lecture will be devoted to impression materials, gypsum, preparation methods, sprays, and impression trays. An impression. It's called a reverse negative image of the relief of the tissues of the prosthetic bed and adjacent areas. The main impression is obtained from the jaw on which the prosthesis is made. It's called work model, work impression. And the auxiliary impression is from the upper side, for bite. Types of impressions. There are two types of impressions, anatomical and functional. Anatomical impression is obtained using standard impression trays, and functional obtained with the individual trays or spoons. Groups of impression materials. There are several groups. First, here's crystallizing impression materials that harden the oral cavity. Gypsum, zinc oxide of phenol. Impression material that remains elastic after polymerization, charcoal, alginate, and silicone. It is the second group. And thermoplastic masses, which become plastic when heated and harden in the oral cavity, like the masses of the first group. Crystallizing materials. First, here is gypsum, and also here is rapine, the zinc oxide of phenol. To obtain medical gypsum, natural gypsum is subjected to a special heat treatment, during which it's converted from a dihydrate into the hemihydrate, beta hemihydrate. Super hard gypsum is 2 or 3 times stronger than usual and is obtained by processing natural gypsum with saturated low pressure steam, alpha hemihydrate. Types of gypsum. Beta hemihydrate, alpha hemihydrate super gypsum. Here are 5 types. First type, we use it for impressions from the auxiliary jaws, not for the work models. And you can also make an impression in oral cavity. And here 4 other types. The second type, the fourth type, the third type, and the fifth type. There is also fifth type. Something later we will discuss the difference between the fourth type and the fifth type of gypsum. And there are also natural, mineral, and synthetic. Type 3. Type 1 and type 2, we use it only for impression in the oral cavity. We don't use it for casting models. And type 3, it's hard. It's used for manufacture of diagnostic and working models of the jaws, and the technology of removable dentures or non-removable dentures when you use it for diagnostics or for auxiliary models. Type 4, super hard, used to obtain working models of the jaws in removable or fixed prostheses. Here you can see the classification, the table about these types of gypsum. And if you look at this one, you can see that type 4 and type 5 are mostly have the same characteristics. It has one very important difference. The expansion coefficient of this one is about 0.1, and the expansion coefficient of type 5 is about 0.3%. And so this one have a higher expansion coefficient. So it's usually used for big works, including big works on implants. For example, total works. About gypsum, about its crystallizing. Up to 50 degrees, the setting speed increases, and after 50 degrees, it slows down, and at 100 degrees, it doesn't set. Dispersion of the powder, the finer the plaster, the faster it sets. Methods or mixing speed. The higher the mixing speed, the faster it hardens. And additives, catalyzers and inhibitors. Catalyzers, table salt natrium fluoride from 2 to 4%, potassium chloride, califluor up to 2%, potassium sulfate, and inhibitors, sugar, borax, ethyl alcohol, C2H5OH. The second part of this crystallizing material is syntaxid, epinol, and Prussian materials. They have the following advantages: fast hardening in the oral cavity, high plasticity, no not toxic, and no shrinkage. No, it's very important that they have no shrinkage. Disadvantages: fragility after hardening. It's very bad. Lack of adhesion to the impression tray, unpleasant taste, and strong smell of eugenol. They are used for temporary fillings now, for temporary fixation of non-removable structures, but due to very aggressive nature of zinc-oxygenol, it's mostly we fix temporary on non-eugenol material, because if you use eugenol including materials, you will have problems with the permanent fixation. And also for obtaining functional impressions using individual trays from the toothless jaws. Alginate impression material. This is one of the most frequently used materials in dentistry. Not only in orthopedic but also in orthodontics. They have the following advantages: high plasticity after mixing, satisfactory accuracy, elasticity after structuring, good patient tolerance, easy of preparing, easy of separation from the model, and low cost. Disadvantages: this is low adhesion to the impression tray, high shrinkage, low mechanical strength after structuring, difficulty in disinfection. So, due to high shrinkage, you have to cast model from this impression from 15 minutes to 2 hours, not more. But also, for example, Hydrogum 5 days, they announced that we can cast model from this impression up to 2 days. If you will put it into the warm water. Yes. Indications: this impressions in removable prosthetics, in maxillofacial orthopedics, and for oxalary models. In very high humidity if you will put this impression with impression tray into a high humidity, you can cast model from it and tomorrow or the day after tomorrow. Here are the examples of these alternate materials. Next, silicon impression materials. There are two types of silicon impression materials. This is C-silicon and A-silicon. C-silicon, it was earlier. This it's C, the condensation, so-called it's polymerized by polycondensation reaction. And A-silicon, this is additive. When chain increases, yes, this is called polymerization system. Indication for users. They're very frequently used in the industry, not only by or by in prosthetic dentistry. It's also used by therapeutics. When you need to manufacture a silicone key, for example, for some anterior direct restoration, for example, or posterior direct restoration, no difference. And silicone materials are recommended for use in the manufacturing of crowns, tabs, veneers, metal ceramics, or porcelain bridges, glass processes. They cannot be joined when taking an impression to silicones and acetylcones, as there is no adhesion between layers. And I need to say that you don't need to mix A-silicone and C-silicone. For example, if a correction paste you have from A-silicone and base material from C-silicone, you cannot mix it. It's absolutely denied. C-silicones, they have the following advantages. Good adhesion onto the tray, precision, low shrinkage, relatively cheap. Disadvantages: shrink, highly hydrophobic, the impossibility of casting models 2 times. A-silicone, they have maximum accuracy, strength, choice of viscosity grade, compatibility with the mucous membrane, stability, but they have a sensitivity of catalysts to external influences, and they have very high cost. When it consists of 3 components: A-silicone. This is consider only A-silicone, because C-silicone, they have no different base paste. This is the same, and this is about A-silicone, and C-silicone is old pattern. And this is because you can use it for different types of work. So you can use it for implants, you can use it for crowns, you can use it for pinlet tabs, for using it with pinlet tabs when you manufacture it. This is very heavy, this just high, medium, and light. One of the biggest advantages of this material of A-silicone, this is only one example, right? Because you have clear understanding what to do with the correctional paste. You don't need to mix it manually. This is semi-automatic dispenser. You charge it and you push on this stick. And here is canoe. And after that, After that, when you push it, you press it. It's mixed in this cannula, and you can put already a mixed material into the first layer, into the oral cavity. It's no different. Next one, the polysulfide or charcoal impression materials. They're not so frequently used. In terms of resistance to deformation, they are superior to C-silicones. They're accurate, were practically non-shrinking, have tensile strength, but have an unpleasant taste and smell due to the formation of hydrogen sulfide, as in old eggs. Yes, and too sticky with interferes with work. I don't use, and I don't advise you to use it. Yes. And then the next one. This is polyester impression material. They have big advantages. They have very high precision. They have big mechanical stability and very thixotropic. They're very expensive. They're very expensive. The high hydrophility, hardness after polymerization, poorly polymerized with the presence of blood, and the irritation of soft tissues is possible. But the most important disadvantage is the hardness after polymerization. It's very hard to take it off from the oral cavity. Next one, combined impression materials, combined expression. They are in the research stage, but we also have to learn it and have to use it. It's a new group of materials based on the synthesis of ACE additive silicones and polyester materials, aquaseal. Thermoplastic, like stands and others, they have now it's not frequently used, but when I have already worked, I have already graduated from university. It was in 1995, and I for 10 years, the following 10 years, I have worked in the hospital in maxillofacial as a maxillofacial surgeon. I use it. I use this one like stents. When we make a correction for obturators for children, when we make surgery for correction of some bone defects. Yes. They have advantages because they have prolonged plasticity phase. You can heat it and it will be ready for enough time, which allows for functional tests, the possibility of repeated insertion of an impression into the oral cavity, and its correction due to the connection between the layers of the material. The disadvantages need for immediate casting of the model. The possibility of burning the mucous membrane of the materials if you don't hit it correctly, or you hit it, or you overheat it. And used for taking impressions for toothless jaws as the main material for double impressions for obtaining auxiliary impressions also. Preparation steps for obtaining an impression. First, you need to retract the gingival margin on the area of perforated teeth. if it considered, if it concerned to turn about non-removable constructions, for example, crowns and bridges. Then cleaning the oral cavity before taking an impression, and ensuring good adhesion of the impression material to the tray. Here is mechanical refraction. It can be physical, it can be mechanical and chemical refraction. We shall speak about some later. If you wonder and if you don't sure that you will have enough adhesion your material to the impression tray, you can use this impression material adhesives. You put this here is the applicator in the bottle. Here you can see it, and you unscrew it. You apply some adhesive on the trace margin or on it all the surface. It depends on the model of this adhesive and the model of your impression material. It's very useful. The steps of making impression. First, you need to select a spoon. Then you prepare your impression material. Then you apply this impression material to the tray. You insert a tray into the oral cavity. You're forming the margins, the edges of your future prey. Then, when you feel that your impression have polymerized, you remove this impression and tray from the oral cavity, and then make an assessment on impression. Impression trays. Here are standard and individual impression trays. Standard impression trays. Here you can see a big table. They can be from plastic, from metal. They can be with perforation, with a hole. They can be without perforations. And if you use this one, you need to use adhesive. Absolutely, I'm sure in it. Then there are different size shapes of impression trays. And in the upper jaw, you have 10 sizes, and in the lower jaw, in the mandible, you have 9 sizes. For the upper jaw, for lower jaw with teeth, or teethless jaw. And also you can have an impression tray for this situation when you have teeth only in the anterior region, because it's very frequent situation. Here we can see impression trays. Here, this is a standard tray. This is individual trays. They're made, have been made according to the situation in the oral cavity, and you cannot apply it on the jaw of another patient. Only your patient. Correct selection criteria standard for standard impression tray. The side of the spoon lags behind the alveolar process or the vestibular and oral surfaces of the teeth by at least from 3 or 5 millimeters. The teeth apex of the alveolar ridge are in the middle of the alveolar surface of the impression tray. The spoon is centered. Its symmetry coincides with the central aesthetic line of the face. The distal edge of the tray should overlap the lost molars. no, it depends on what you're going to do it for. If you have, for example, a tube for non-ceramic or metal ceramic in the front region, you don't need to overlap molar, for example, the third molar. But if you are going to make a removable denture, yes, it's very important to overlap a little tubercules and the lower jaw mucous tubercles. On the upper jaw, in the area of the hard plate and then towards a lower jaw, the distance between mucous membrane and the convexity of the tray is from 3 or 5 millimeters. The side of the spoon should reach up to the transition fold. On the lingual side of the lower jaw, the bead should be longer to press deep into the soft tissues on the floor of the oral cavity. There are a large number of different methods for obtaining two-laid revised print, but all of them can be grouped as follows. There are two-step techniques and one-step technique. The primary preliminary impression, this is a two-step technique. When you first mix base layer, and then you apply when it polymerized, and you take it off. You dry it. You correct it if you need, and then you apply the second correctional layer and insert it again into the oral cavity for the second step. The primary impression is taken with a mass of crushed consistency. Yes, well, two-step, two-phase technique. After structuring, after polymerizing, it's removed from the oral cavity, washed and dried. The purpose of this stage is to form an individual spoon, understand, an individual spoon for more fluid correction mass. And here you also can do it not only after you have prepared your teeth, for example. Some dentists do it before preparation, and this first step, with the base phase, you do it before preparation. Then you prepare your teeth, and only then you apply the correctional, the second phase. This is this you make correction for this is preparing preliminary impression, for example, and this structures you need to delete the extra correction, extra quantity of or extra quality of correctional paste. When you are going to make the second step of this impression. After that, you before carrying the second stage of obtaining the two-layer impression, the first retraction thread is withdrawn from the periodontal groove. After removing the thread, in order to completely wash off the residual chemical substances, the groove is rinsed abundantly with water. This is the second, not the third, the second retraction thread. Usually, we use the technique of two threads, the first and the second. And the second thread, you take it off. You remove it after the first step, and the second thread you remove after you have made the impression. You finish the second step. Then you applied this correctional paste. And this is a ready print. Ready print. Here you can see macro photo of it. Yes, here it is. Here is two-layer impression. Two-layer impression, classic. You have already saw like this. Isolated wash technique. This is polyester. Like impregnum. This is very good, very expensive material. Just like that. Two-layer quick kneading technique also. When you need to make a one-step technique, it used mostly it's used when you make an impression from for implants. It's very well, you will have very good results because if you have many implants, they can be due to different anatomical conditions. They can be not absolutely parallel between themselves, especially if they're situated on the different parts of the jaw, on the right part and on the left part. And so, if you don't want to use multi-unit structures to correct the situation of the orientation of implants. You need to make an impression with the open transfer tray, so-called open transfers. And that's why you need to make one-step techniques. Or this two-layer one-step technique impression using a syringe, conventional or injection technique. This one. Sandwich techniques, and just like that, you don't wait for polymerization of the first layer. You apply it immediately the second correctional mass on it, and insert it in the oral cavity, For example, this one, I think. Yes, you mix the base paste. Then you apply. I want to say that this is not the best case, because usually it's better for technician and for you to have different colors of correctional paste and of the base paste. They're absolutely just the same. This light brown and this orange. And when you have, for example, this one orange or light brown, and this will be blue, for example, you will better check. You can better check all the problems you have during preparation. Then you put it into the oral cavity. This is one step by two phase. Yes, this is the final result. And this is obtaining two-layer one-step impression with an individual tray. This one. First of all, this is your second meeting with your patient, at least the second meeting, because you have also he had also visited you before, and you make an anatomical impression, for example, with the alginate impression material and with a standard tray. Then after that, your dental technician made this individual tray, and you check its position, and then you begin to make a two-layer one-step impression by individual tray. This is all the difference. For the first time it was standard, and now this is an individual tray. For example, here's transfers from for open transfer impression tray, just like that. This is for transferring the situation in the oral cavity to the noodle. All like this. This is a functional impression. This is a functional impression. This is the impression that you made with the individual jaws. This is a functional impression from toothless jaws, one stage, one phase technique. For example, this is the special. They are different. Impression materials. This is they usually used for making impression from the non-removable, for crowns, for bridges, and we rarely use it for removable dentures. But in this case, the dentist did it because I think it didn't have the second part of it. This is Mandizil Bisikov from it's a very big company. It's a very good company. And this Mandizil, it usually uses only for lower jaw. And for upper jaw, we have another material. We have S4, so-called S4 material. It's used for the upper jaw. Here, in this case, they connect the second in a second meeting with your patient with a third meeting of your patient. They're trying to establish the central occlusion, to fix central occlusion. Well, that's all. That's very good. I wish you you watched this presentation. If something unclearable will be unclearable for you, I'm waiting for your questions in group chat, and I think that we will not meet until February, because in Russia it's very dangerous and serious situation with COVID, and I think that from the end of October, from the 23rd of October, we will go on holidays for 2 weeks at least. Thank you for paying attention.